Good morning, greetings. My name is Lauren Arrington. I'm a midwife and a professor. I'm from Baltimore, Maryland in the US, and my work focuses on implementing strategies to address reproductive justice in clinical settings. On January 29th, 2013, I was at home, 40 weeks pregnant and 6 days. I was anxiously awaiting my third child. I had given birth previously in a birth center and at home, and this time I was 3 years into my career as a midwife and decided, why not give birth at the hospital where I work? I had been working really hard all day to get into labor. I had been praying, meditating, walking, and as the evening fell, we put our 2 other children to sleep. Shortly after that, labor kicked in. It was intense, it was fast, it was magical. I looked up in the throes of this labor at my husband, Jaleel, and I instinctively asked him to shave, to put on some clean clothes, to freshen up, to smell good before we left for the hospital. He obliged, but before he could get very far into that, my water broke and we realized this baby was coming. We crouched down on the floor in our bathroom. Jaleel became my midwife and welcomed our baby Sankara safely into our arms. Later, I would wonder, why in this moment of labor, of intense, powerful, bringing life into the world, was I worried about what Jaleel looked like? And I realized that I was practicing a behavior that was imprinted on me by previous generations. From my mother, to my father, to my grandparents, every time they entered a healthcare facility, they always did their best to distinguish themselves as different, as special, as not your average Black person. Somehow, based on their education or a connection, they wanted to demonstrate that they were worthy of respect and of dignity and of equitable care. Karen Scott and Dana Ayin Davis, 2 researchers on Black maternal health, call this racial reconnaissance, the practice of Herculean efforts that Black people engage in to try to protect themselves from racism. While I felt known by my coworkers and respected by them, I also knew them, and I knew our health system, and I knew the bias, the judgment, and the pervasive assumption that Black individuals were more likely to have poor outcomes. I realized in that moment that my health system was not trustworthy. This birth was a pivotal moment for me. I had been trying to address racism through the individual one-on-one care that I provided and through my teaching, but I realized that I needed to do more. I went on to lead health equity initiatives at my hospital and to eventually take my dream job as a maternal health advisor for a global health organization. We did some good work, but I will never forget a night in West Africa at a restaurant at dinner with 2 of my US colleagues, where they spent the evening talking about how incompetent the country office staff were, the experts that we were there to partner with. I felt like I was sitting next to 2 colonizers trying to justify their existence and their rationale for colonizing. I realized in that moment that while we were trying to do good work and address maternal morbidity and mortality, we were doing it in a way that pathologized the communities we served, that was focused on medicalization and on making the West seem like this savior and amplifying them. In that moment, our work was not worthy of trust. as much as we were trying to do the right thing, we were doing it in the wrong way. When I see the statistic that 17% of the world's population lives in Africa, and yet 70% of maternal deaths occur in Africa, it's very clear that there are tremendous upstream factors that we are not addressing. Across the globe, there is a systematic, uneven investment in the reproductive health and well-being of some communities and a divestment in the reproductive health and well-being of others. So what can we do to address this catastrophic phenomenon? In 2016, I began working on centering pregnancy initiatives. Centering pregnancy is a model where pregnant individuals come together as a group and receive care with their providers in a way that shares power, centers the expertise of everyone that's there, and ensures that dignity is assumed. Centering pregnancy is more than a clinical model. It is a blueprint for the health system that we need. So, today, I am leveraging the centering pregnancy model to do global health on my own terms. I'm working to serve as a conduit for reproductive health practitioners from across the African world to collaborate with each other to expand liberatory care practices that are rooted in radical imagination, decolonization, and respect for ancestral knowledge. Liberatory care recognizes that addressing injustice is an essential part of health. And it's less about the lofty health outcomes we can aspire to achieve and more about how we do it. It's about embodying on a small scale what we want to see on a large scale. It's about pursuing the right things in the right way. When I think about the future, I'm inspired by writers such as Ruha Benjamin, Adrienne Marie Brown, and Rob Hopkins. They remind me that there is this sense today that problematic actors are trying to colonize our vision of the future, but we don't have to let them. My son Sankara, who was born on the bathroom floor, he is almost 13 years old. What am I imprinting on him? Am I teaching him to prepare for a world of harm? Or am I helping to create a world that is actively reshaped to prevent harm? Each of you embody on a small scale through your work the future that I dream of on a large scale. Our work that we are doing has the potential to embody liberation and collective care and shared power. And as we generate that over and over and over again, we create more opportunities to experience our desired future. So my invitation to you is to time travel for health equity. Let's time travel. Let's continue to be the just and equitable future we want for the world. Let's make that happen in the work that we do, in the organizations that we build. Let's create worlds. Let's build worlds where we center the possibilities for the future, where we enjoy them, where we fall in love with them, where we see a brighter future. And through that, as we generate this longing for this future that we want over and over again through our work, I believe that we will show ourselves and others how to get there. Thank you.